Okay, I guess we can start now. So, good afternoon, everyone, and welcome to the fourth session of our Do Health Systems Deliver webinar series titled Learning from Others, International Comparisons. I'm Dr. Khalid Dosri, a health policy manager at the Center for Value in Health. In our previous sessions, we have explored the groundbreaking OECD patient-reported indicator survey, PARIS, which illuminated the key patients, provider insights, and health trends in Saudi Arabia, and also understanding the primary care capabilities. And today we turn on the lessons learned from different countries, what any significance that have been shared from them, and the lessons learned into policies. So in the first segment here today, we are honored to have Dr. Sarah Al-Mnif. She is the Director of Measurement at the Center for Value in Health and the National Project Manager for the OECD's Paris project in Saudi Arabia. She has a background in medicine and doctorate in public health. She will recap us on the previous sessions and also how to leverage the data into policy decisions towards a high-value health sector. We're honored to have here also Dr. Michael Vandenberg from the Organization for Economic Cooperation and Development, the OECD, OECD Health Division. Michael Vandenberg is a policy analyst at the OECD and international project manager for Paris. He has a background in sociology and a PhD in health services research, and has over 2 decades of experience in health services research and policy, and in particular in the areas of primary care and performance of health systems. We also have Deborah Miranda, who will share her experience from Portugal. She is a health communication consultant dedicated to bridging science and society. She is currently responsible for the communication of the Paris study results in Portugal through the country's Directorate General for Health. And I encourage you, our esteemed audience, to actively participate by submitting your questions via the Q&A function, and also by upvoting those questions that you would like us to ask our participants, and we will try to accommodate as many as possible. So without further ado, I would like to begin by inviting Dr. Sarah Al-Mnif to give us a recap on what we have shared and learned so far in the previous episodes, and also to kickstart the discussion on how does Saudi Arabia compares to other countries and what are the lessons learned from them. Dr. Sarah, the mic is yours.
Sorry, I started talking, then realized I was on mute, of course. But thank you, Khalid. Thank you for the introduction, and thank you for our audience for joining us for the fourth webinar. I'm sure you're joining us out of interest and bearing with us for 4 sessions, but all of what we discussed during the past 3 sessions were really interesting about the Paris results. Today's a special session. We have international speakers and international guests joining us. And again, thank you for joining us for the 4th episode, hosted by the Center for Value in Health. So over the past month, we've explored how patient-reported data through Paris can inform and drive transformation in Saudi Arabia's healthcare system. Today, we wanted to turn our attention outward with the kind of a global lens. In this session, learning from others, it is an opportunity to understand how our health system compares with those of other countries and how we can learn from other high-performing peers. We're especially pleased today to be joined by Mr. Michael Vandenberg from the OECD, who will guide us through the international findings and offer valuable insights that can help shape our local policies and strategies. From Portugal, Ms. Deborah Miranda, who's going to provide us with the experience of Portugal of applying this international survey and give us some lessons learned. As always, as Khalid mentioned, we welcome participants from across the healthcare ecosystem, policy, clinical care, research, advocacy, and we would also like this to be an interactive session. So please feel free to submit all your questions through the Q&A bot, and we'll address as many as we can. So before we begin the session, I wanted to take a moment to reflect on the journey we've taken through this 4-part webinar series. The series been built on the insights from the flagship report, which provides groundbreaking data on measuring truly what matters to patients, the outcomes and their experiences. We kicked off with a foundational session introducing Paris in Saudi Arabia. We explored who our patients are, the providers serving them, some of the key demographic and clinical trends shaping care delivery in Saudi Arabia. In the next session, we focused on PROMs and PREMs, which is the heart of what we're doing for Paris, and discussed how these tools can help capture what matters to patients. And the response was incredible, and it sparked strong interest in practical implementation. And this led us to organize an additional bonus session, if you can say, in response to the popular demand. The Council for Health Insurance is going to walk us through their national feasibility study on PROMs, covering the what, why, and how of implementation, and challenges faced and lessons learned. That's going to be the week after next. Our third webinar took a deeper look into the organizational and clinical factors that support high quality care. We discussed aspects other than PROMs and PREMs, so access to information, time spent with patients, care coordination, and shifting the focus from just outcomes to the systems that enable them. And that all brings us to today's session, our final episode of the series, you can say. We step outside the borders to see how Saudi Arabia compares internationally, and we'll learn from our global leaders on how to explore the international best practices and how they can inform and accelerate transformation. With the 5 episodes now spanning data, tools, care capabilities, and international comparison, the series has kind of evolved into a collaborative platform for turning insights into action. And we really thank you for being part of this journey. So I'm not going to take so much time, but it's a quick overview of what we'll be covering in today's session. I'll just give a brief recap of our journey so far. And then the core of today's session is going to be a chat or a presentation by Dr. Vandenberg, and he'll share how Saudi Arabia compares to other countries. And then we'll highlight some practical examples from Portugal, and then we'll take question and answers from the audience. So in our earlier sessions, we introduced Paris as a global effort to better understand the outcomes and experiences of people with chronic diseases. We know that Paris focuses on what truly matters to patients, how they feel, how they function, how they experience care. Making it a really powerful tool for delivering more person-centric care. It's a unique opportunity for international learning with over 20 countries participating. Paris enables us to benchmark Saudi Arabia's performance globally using the standardized data. And then later in today's session, we'll hear more from Michael on who's going to walk us through how countries are using the data and what insights we can draw from international comparison. So in our earlier sessions, we also shared preliminary findings from Saudi Arabia and how care is delivered and experienced in primary care. The data touched on a range of system level themes, from structure and location of practices to how care is accessed, who delivers it, and how services are financed. We also examined some digital infrastructure, coordination of care, the use of care plans, and support for self-management, each of which is equally a critical role in shaping quality and continuity of care for patients with chronic diseases. The results revealed several important findings I'm just going to touch on, but patients' insights underscored the really high burden of chronic diseases, especially among younger populations, as well as the rising multimorbidity linked to behavioral risk factors. The provider data gave us a clear picture of how primary care is organized and where gaps in integration and workforce structure remain. And system trends highlighted the very fragmented nature of service delivery and the urgency for strengthening primary care as a foundation for long-term health. And then finally, measurement practices noted to the opportunity and need to embed standardized, validated, patient-reported metrics across sectors to ensure consistent and meaningful outcomes tracking. Just touching on the results from Saudi Arabia, the majority of respondents reported living with a chronic diseases, at least one chronic disease. The prevalence was increasingly notable by age group, so we conducted the PARIS project on 2 age groups. 80% of adults aged 45 and older, and more than half of those aged 18 to 44 had at least one chronic disease. Among all of respondents, the most frequently reported health issues were musculoskeletal problems such as arthritis or back and joint pain, followed by diabetes and hypertension. Respiratory conditions were also commonly noted, alongside mental health challenges. And most importantly, 1 in 5 patients reported living with multiple chronic diseases, which is a really growing burden of multimorbidity. So just wanted to touch on the key domains measured in PARIS through PROMS and PREMS. Physical health, which looks at health conditions that affect day-to-day life, walking, lifting, and moving around. Mental health focuses on emotional well-being, symptoms of anxiety, depression. Social functioning assesses the impact of health on a person's ability to engage with work and family and social activities. Well-being captures a person's overall sense of life satisfaction, reflecting on their how it affects their quality of care. And general health provides a self-assessment of overall health. When we look at the PREMS, it assessed confidence to self-management, which evaluated whether people feel equipped to manage their health independently. Care coordination, which measures how well care is organized across providers. Person-centric care, which focuses on whether care is responsive to patients' values and needs and preferences. Experienced quality, which reflects on how they rate their care. So is it timely? Is it respectful? Is it effective? And finally, the trust in healthcare system, which really studies the public confidence in the fairness, accessibility, and reliability of the health system. These indicators offer a comprehensive picture of how care is delivered, experienced, and lived, enabling really better decision-making for clinicians and policymakers. So results from Saudi Arabia, this presents the percentage of patients who reported positive outcomes and experiences, comparing those with chronic diseases and without in both age group. Just a key takeaway is the consistent pattern of poor outcomes and experiences among individuals with chronic diseases, especially in areas such as physical health, well-being, and trust, which is the additional burden the group faces in managing their care. One of the most striking findings is the low rate of care coordination, particularly among younger patients. This really not only signals an area of improvement, but also mirrors what's been flagged in the flagship report. I think Michael is going to touch on this more, but while mental health scores are pretty strong, it doesn't always translate to high levels of well-being. So the patterns might not be in line with what we're seeing, and something requires more holistic support. And finally, self-management supports that really stands out as an area of concern. They are below international averages, indicating challenges with health literacy and patient confidence in managing their health. And finally, in our last session, we just took a closer look on care capabilities that were assessed by PARIS. They go beyond outcomes and focus on the how of care delivery, whether systems were really supporting patients managing their health. We covered some aspects such as communication and shared decision making, care support and education, workforce and digital tools, access and online services, coordination, planning, and finally self-management. And we highlighted some gaps and discussed how some of the aspects can empower patients to take control of their health. And these insights were really a foundation for today's discussion, and where we'll zoom out and compare how Saudi Arabia is performing in these areas and in PROMs and PREMs relative to other countries. This international lens gives us a clearer sense of where we're making progress and where there's room to grow. So without further ado, we're honored to be joined by Michael Vandenberg, a leading expert from the OECD and the driving force behind PARIS. He's going to walk us through how Saudi Arabia compares with other countries based on the PARIS data and share some powerful experiences of how nations are using patient-supported measures to guide healthcare improvements. And so please join me in welcoming Michael to share his insights. And Michael, the floor is yours.
Yes. Sorry, I was looking for my mic, but you should be able to hear me now. Thank you very much, Sarah. That was an excellent introduction, and there was actually a bit of I would say functional overlap in it, so that saves me some time to explain all the ins and outs on the survey. So I know that this is a webinar in a series, so I assume that many of you already have a pretty good idea, particularly after this presentation, about what PARIS entails, how it works, the methods. But just as a brief reminder, I would like to say a few things about it before I move on to the results. So the underlying thought is that, well, as one of our patient experts that we worked with, is a patient benefit is the point of all healthcare, right? So, but while we have a lot of data these days on how much countries are spending on healthcare, on their infrastructure, their number of hospitals, beds, and clinical outcomes, and so on, life expectancy, it's still very rare that we systematically measure what patients say. And this is actually quite strange because, yeah, it's important to understand how does healthcare impact people's life and how do they experience it. So that is what PARIS is all about. And this is also what the ministers of the OECD countries agreed on in 2017 when they called on the OECD to develop PARIS. We have 38 member states. Saudi Arabia is not one of them, but Saudi Arabia is a very committed partner country in PARIS and also other work of the Health Committee. So I also want to thank your country for having provided really strong leadership, I think, and having contributed to the success of this project in general, on top of what you have done for the country itself. So you already said a little bit about it, but just as a reminder, this survey is not a population-based survey where we draw a sample from a population. It is a stratified survey. So we are sampling primary care practices and then patients in these practices. And the advantage of that is that we are able to link results from patients level and practice level, and are able to identify certain practices that might help generating better results for patients. So there are about 107,000 primary care users, 45 years and older. Saudi Arabia has oversampled and has also a part of a younger population. I will not talk about this part of the population in my presentation because this is all about international comparison, and the other countries don't have that young part of the respondents. Also, compared to most OECD countries, Saudi Arabia has a very young population. So I think it was a really wise decision to sample also these people in your country. Then we have 1,800 primary care practices. And as you said already, Sarah, I think the the whole point of what I'm presenting today is international comparison, and most importantly, international learning. It's not a competition. It's not just about who is ranking higher or lower on certain indicators. It's about what can we learn from each other. And if you're zooming out and see how your country performs in relation to others, that might be, in many cases, a big eye-opener to see, well, is there something that we can learn from others? Well, here you can see a graph that you can find in the country note for Saudi Arabia, because on top of our flagship report, we published country notes. And this is what we call a radar plot. And you can see around the 10 key indicators, the Paris 10 that Sarah already showed you. And the middle line is how Saudi Arabia scores on these indicators, and the other two scores for each indicator, the highest performing country and the lowest performing country. And what you can see here is that particularly on the health indicators, the PROMs that we see in the right side, that Saudi Arabia is scoring quite high. And in some cases, it's actually the highest scoring country, for example, for mental health, for general health, also social functioning, very high scores. On the PREMS side, you see that it varies a little bit more. And as already highlighted, particularly experience coordination is the first thing that attracts your attention when looking at this graph. Here, Saudi Arabia is scoring particularly low compared to many, even though it's not the lowest scoring country, but it's scoring pretty low in relation to other countries. So we will get into that a little bit more in my next slide. Well, when we combine all these indicators all together, you can get a little bit of sense on where the country stands in the global picture. Well, here you can see that Saudi Arabia is the same as Canada. Actually, on half of the indicators, they score above the OECD average, on 4 around the average, and on 1 below the average. And that is, of course, the coordination indicator. Well, again, they start to look like contest ranking, but that's not the point. So you should not interpret it this, so Switzerland has the best performing healthcare system. No, based on these 10 indicators, we did not do a weighting of the indicators. It's just a summary of the 10 key indicators and the result, and it gives some sense of where the country stands. And in general, we could say, well, Saudi Arabia is performing pretty good on most of the indicators in Paris. Here is a graph of which you can find several in our report. It requires a little bit of clarification. So this is one for where we compare mental health scores between countries. And every dark dot that you see here represents the average of a primary care practice, the patients in that practice. And this is demonstrating the value of having sort of multi-level survey like we do. We're not just giving a country figure, but you can also see what is the variation within inside the country. And you can see, for example, if you compare Netherlands and Norway, you can see that they score pretty similar, but that in Norway, there's much more variation between primary care practices. In other words, it makes a difference in which primary care practice you go as a patient, much more than in the Netherlands. Well, other interesting result here is mental health. As already mentioned by Sarah, it's Saudi Arabia is really a strong positive outlier. They're totally outside the range here. And well, we have discussed this a bit with the team, because usually if you see such an outlier, there's something with the methods. I said, are you sure there is nothing wrong with the translation? So please have a look at that. But yeah, we're using a validated PROMIS scale here, and I looked into that. And well, it's still interesting to dig a little bit deeper, but our impression is that it's more, maybe has to do with a cultural element. And we try to rule that out as much as possible, but still you cannot rule it out 100%. But apart from that, I think it's still safe to say that mental health scores are pretty good, pretty high in Saudi Arabia compared to other countries. Well, here is another example of well-being. And as you can see here, Saudi Arabia is scoring much lower. And it's interesting because mental health and well-being, they are strongly correlated. So over the whole sample, there's a correlation of 68.68. But in Saudi Arabia, apparently this clearly has a different meaning, because on well-being, the scores are a bit lower compared to mental health. Then one more example is on the coordination of care, of course, because this is something which is clearly a point for attention and something to invest in, I would say, in Saudi Arabia. The country is scoring quite low compared to most other countries, and there's also substantial variation. So in other words, you may be able to learn from other countries, but also in the countries, it's worthwhile to identify some good practices that can help other practices to improve. Then I'd like to highlight one interesting indicator, and I think we're not going into like all the 10 key indicators because that would take too much time. But I think this is a nice example of a Paris indicator because it's not so clinical. It's really saying something about how people's social life looks like. We call it social functioning. On the right side, you can see how this question was asked for people. Also here, you can see that Saudi Arabia is the highest scoring country on social functioning. And we make a breakdown between people with 1, 2, and 3 or more chronic conditions. And the conclusion is, with each additional chronic condition, you see that the level of social functioning decreases. So, and this is a clear problem of multimorbidity. Well, you see that the same effect appears in Saudi Arabia, but I find it quite striking that even the people with 3 or more chronic conditions score quite high, and they score even like higher than in some countries the people with 1. So the effect is the same, but the range, the gap, I would say, is a bit smaller. Then, and well, just to mention the flagship report at the end, I will provide a QR code where you can find it. But we have touched on several different domains, and I'm just giving you a broad overview. And one chapter is about inequalities. And here you can see the gap between the genders, men and women, on mental health and physical health. And as you can see, the first thing that you see, all the bars on the left side here are the axis. That means that in every country, women score lower than men. So there is a gender gap, and there is always in the same direction. It is what we call the gender health paradox, because women usually live longer. They report higher life expectancy, but if you ask them about their health, they experience a lower level of health physically and mentally. And here you can see that what is quite interesting, I think, in Saudi Arabia is that particularly on the physical health, the gap is quite big, and it's a bit of an outlier, I would say here. So in other words, women score much lower on this than men. The same effect we see from mental health, but it's much smaller. So that is a gender gap. We also looked at socioeconomic gaps, and these are gaps between income groups. Also here, all the bars at the same side of the axis, which means that maybe it doesn't come as a surprise, but the people with higher incomes always report a higher level of mental, physical health on average. So this is not like a groundbreaking revelation. We are aware of that, but it's also here, it's interesting how the gaps differ between the countries. And here the gaps are relatively small in Saudi Arabia. So they're here on the top, and they're sorted by the mental health gap from top to bottom. And you see actually on both, the gaps are quite small. Then, so these were a few examples of indicators and how you can, the different ways you can look at them from an international perspective. Now, there were a few outcomes of the reports. So if we take a step back and look at the bigger picture, we started to see some patterns. So there are 3 elements that we think can help in general improving the healthcare for people with chronic conditions, and we call them the 3 Ts. So time, tailored care, which means tailored to the specific needs of the patients, and what you call trouble-free. So it's important that healthcare goes smoothly, that things are well coordinated, that different care providers work together well. So that the trouble is usually on the side of the patients, navigating their way to the health system, having to repeat information, information is on different places, and so on. And I'm going to give you a short example of all three of them. So to start with time. So here you only need to look at the top here with the two red lines. What you see here is the estimated effects of a relationship between primary care provider and the patient for longer than 5 years, and the effect of it on the experience quality of care. The same for the time spent per consultation. The others are, we consider them here as control variables. Now, what you can conclude is that people who are longer with the same primary care provider and have more time during the consultation, they experience a better quality of care. And this is not entirely new. There's more literature that shows, particularly with consultation length, that longer consultations are often better consultations. Well, looking at the international perspective, it's striking that there's such a range in the length of consultations. And here you see, for example, Portugal, we will talk about later. Here's on the left, the consultations are relatively long. But they are, most of the time, they spend more than 15 minutes. Saudi Arabia is more on the right side, so the consultations are relatively short compared to most other countries, in most cases 15 minutes or less. And here we see an example of the people who have been with the same primary care professional for more or less than 5 years. And also here we see that Saudi Arabia is on the right side. So people are relatively short time with the same primary care professional. But you can imagine that this works a bit two ways, because if you would be very unhappy with your primary care professional, you were also more likely to change. But it also works the other way around. So if you are longer, you build a trusted relationship. And so here, two elements of time, I think, would be interesting for Saudi Arabia to focus on. Tailored care, I give you one example here. This graph shows on the vertical axis well-being. It's WHO 5 scale. It's a internationally commonly used scales, for example, for screening on depression. It goes from 0 to 100, and if it gets under 50, it's getting concerning, because that's considered under a sort of critical threshold for well-being. And here we broke it down by high person-centeredness and low person-centeredness. In other words, when people experience a high or low level of person-centered care. And at the bottom, you see examples of the questions that involved. And also here we see that in all countries, there's a clear relation. People have experienced high person-centeredness, they score higher on well-being. And Saudi Arabia, you can see here, it's quite in the middle, but people with the low scores are just under the critical threshold. And so in this, Saudi Arabia is not very different than most other countries. Actually, it's quite in the middle. And here is a more concrete example of what when we talk about coordination. So to coordinate care is the medication review. So it means that the healthcare professional and the patient discuss all the medication that the patient is taking, and that helps ensure that medications are all necessary and safe when taken together. And it's given the patients the opportunity to signal any issues and help self-management. So it's a good practice to do this at least once a year, because sometimes people get medication from different healthcare providers. And you can see here that it contributes to a better experience coordination of care. It's not surprising. And in some countries, it's much more common practice than in others. And in Saudi Arabia, there you are on the right side here. It's a bit less common. It seems that than in most other countries. Then, lastly, the last of the three T's, the trouble-free care. So here is an example of trust. How much trust do people have in the healthcare system? Well, people in Saudi Arabia have a high level of trust in the healthcare system. You score almost the highest country together with Spain. But it takes time to build trust, but it's very easy to lose it. So if something goes wrong, or people have experienced a circumstance that could potentially cause them harm, we call that an adverse event. So, for example, not getting an appointment when needed, a misdiagnosis, and so on. If that happens, you see immediately that the level of trust drops. So the red dots are the people who have experienced such an adverse event. And also in Saudi Arabia, like in any other countries, you see that the level of trust drops when something goes wrong. But still, even then, the level is pretty high on average. This is another example of this, an element of coordination is the need to repeat information. And also here, we see that it's linked to lower trust in healthcare professionals. Well, what is striking here, if you compare this one, which is health in the trust in the system, and trust in healthcare provider, that you can see actually the percentages are not concerning in any of the countries because in general people have a very high level of trust in healthcare providers, but it is Saudi Arabia's comparatively low compared to other countries. But again, I don't interpret this as concerning because actually the variation is very small between the countries. It's still about 75% is trusting the healthcare provider. If you need to repeat information all the time, you see that the trust is lower. But interestingly, in Saudi Arabia, it makes a very small difference where we see, compare with Slovenia, for example, how much difference there is. So that's striking. Apparently, the trust level are quite stable. Then I come to my conclusion. So does healthcare deliver? That's the question that we asked in the beginning. And yes, it definitely does. You saw that Saudi Arabia is performing quite well, many in the indicators, and remarkably high scores, particularly on health outcomes and trust. But there is always a potential for improvement, and coordination of care is definitely one of them, but also time spent on patients. So improving healthcare is not always about fancy things like AI and technology. And so sometimes it's just a matter of allocating sufficient time to patient contacts and building a longitudinal relationship. So being with the same provider for a long time, this is a point for improvement. And last thing that I want to highlight is gender inequalities. In the report, we are doing it relatively superficial. We touched on a few indicators, but it would be worthwhile to delve a little bit deeper into it because it's remarkable that we saw some quite significant gender gaps in Saudi Arabia. With that, here you can find the report, but I'm sure you will also be able to find it online or maybe following this webinar. It's about 300 pages and there's much more material in there. And I'll be happy to take any questions, but I'll hand over now back to our chair.
Thank you. Thanks, Michael, for the really great presentation. I mean, through the past 3 webinars, I've been highlighting some data from Saudi Arabia, but it's really nice now to see how we perform among other countries and look at it from a different context, from the OECD's context. And also noticing the reasons why we're performing the way we did in a positive side or improvements and it's really I mean, benchmarking is really important and looking at international best practices and what other countries are doing. I mean, you mentioned that we're not an OECD country participating in Paris. However, we did participate in Paris. We provided, I think, the only voice from Asia and the only voice from the Middle East. So our perspective is quite different. But these lessons are really important. And that's why we have another speaker with us today that's going to give us a different perspective from Portugal. I'm really happy to to introduce our next speaker, Ms. Deborah Miranda from Portugal. And the floor is yours, Deborah. We'll take questions after Deborah's presentation. So if you have any questions, please type them in the Q&A box.
Thank you, Sarah, and thank you for the opportunity to talk to you about the Portuguese experience. I will just share my screen so you can see my slides. Can you confirm if you can see them? Yeah?
Yes.
Excellent. Okay, so first of all, I would like to send apologies from the Deputy Director General for Health, André Peralta. Unfortunately, he couldn't be with us today, so I'm also presenting on his behalf. And again, thank you for the opportunity. It was really nice, Michael, to hear once again, but in a different in a different setting, the background and the context to this study, and also specifically how Saudi Arabia has performed. So I could see Portugal in many of those slides. Maybe some of you already could compare the performance, but again, we're not here to compete. And so I will just give you an overview of what we have learned from this process. Generally speaking, it has been a very useful experience for Portugal and I'll say DGS when I mean the Director General for Health in Portugal, as the coordinator of the implementation of the study in Portugal. Of course, this being an international study, and of course Michael has already highlighted this, Portugal also fills an important gap through this study by measuring outcomes and experiences that are directly reported by patients. So this is something that perhaps we had already done on an ad hoc basis or in specific regions, but doing this in a comprehensive and international way gives a lot more weight, of course. The results clearly show that we are on the right track in the digital space, specifically when it comes to sharing electronic health records, but there is room for improvement in the areas of care coordination and supporting patients to manage their own health. We'll dive into some of those aspects, but that's one general message. And of course, this study is a starting point to create a culture of listening to patients in a systematic and regular way, so we can provide tailored solutions to their problems. Again, something that we had been doing, or some units would have been doing, but of course it's more relevant for it all to be done in a systematic and nationwide way. Just to give you some of the numbers, of course, I won't dive into all of them, and keeping in mind that we're still doing the analysis for Portugal's performance specifically, but I'm focusing here on what the country node has given us. So we have participated through 91 primary healthcare units, and that covers about 12,000 patients. The demographic profile of these 12,000 patients is quite diverse, and we're glad to see a balance between the genders, but also for the age groups, with almost half of the participants being the age of 45 to 54. Apologies for some of the Portuguese words in here that we couldn't change. Care coordination, as both Sarah and Michael have highlighted, is one of the areas where there is room for improvement. So the results reveal shortcomings in Portugal in terms of the coordination between professional services and patients, with only half of patients considering that care coordination is good. And again, comparing to the OECD Paris average here, we are about 10% lower. In terms of the continuity of care, Portugal's performance is above OECD average in consultation time and support provided to chronic patients by multidisciplinary teams. So that was quite an interesting fact here. So 86% of people with 2 or more chronic conditions have consultations that last more than 15 minutes, and that was seen as a very positive result. The integration of digital solutions is also in healthcare is also good, as I mentioned before. and 80% of patients are followed in health units where electronic health records are shared. So that is also significantly above the OECD average. But again, I'm not saying this in terms of competing or saying who is better or worse, but it does show us that we are on the right track in this particular field. There are significant inequalities that need to be addressed in access and experience. And again, something that Michael has already touched on. Men trust the system more than women, and so do those with higher incomes. Both rank in Portugal significantly lower than the OECD average, and it's something that, of course, Portugal is aware of from other settings and studies and interventions, and definitely something to be addressed. More generally speaking, and of course, keeping in mind that we are here speaking from an international perspective, the comparison is particularly useful. Well, it differs. The usefulness differs depending on the indicators that we're talking about. Here we could see, it was interesting to see the graph that Michael shared about Saudi Arabia. Now we can look at the Portuguese one to see positive outcomes or experiences reported by chronic patients in Portugal when compared to other countries. And we can see that we are actually a lot closer to the lower performing countries that participated in the study. But for example, in terms of the management of the confidence in managing the own health, so the one at the bottom here, we are slightly closer to those that performed better. Confidence in digital literacy is very low, and this is something that we were surprised about, considering that we are, as I said, on the right track in terms of the digital space, with only 1 in 10 people with chronic conditions feeling confident in using health information online. And especially considering COVID, we would expect this number to be higher. But then we also see that this follows a wider trend of OECD participating countries in this study, and perhaps something to address more globally and not something that is specific to the Portuguese context. If we had to summarize our performance in terms of an international comparison, we could say that people in Portugal with chronic conditions report worse health outcomes when compared to other participating countries, and in general, their experiences with healthcare are worse than the OECD average. However, even if Portugal's performance is not ideal when compared to other countries, in absolute terms, we did well. And I think this is where it's interesting to have both conversations. So one at international level and one at national level. International, it's of course relevant to see where we might compare better or less well with other countries. But then at a national level, and especially now with a lot of activities going on to disseminate these results, we can actually see that we are overall doing quite well in some of these indicators. And it goes without saying that people with multiple chronic conditions need more and better support. So that's something that we are also invested in. Those were just some of the highlights. Of course, we have more information, but I also leave you with my personal email address in case you'd like to ask any questions. And thank you.
Thank you. Thank you very much, Ms. Deborah, Dr. Sarah, and also Dr. Michael, for the wonderful presentations and looking at the comparisons of between Saudi Arabia along with the different OECD countries, and also the learnings also from and the results from Portugal as well. And as everyone have mentioned that this is a chance to learn from each other. It's not a competition on where do we find. We understand also each country has its own context and its own healthcare system, and it's really important to learn from each other in order to drive the health system forward. So I believe we have just under 10 minutes, so we can take a few Q&As. So Sarah, if you can look at into them and see if you can answer as many as possible.
Sure, of course. And thank you, Deborah, for the really informative presentation. I mean, it's interesting seeing the similarities between Saudi Arabia and Portugal, but it's also really informative to see the differences. I mean, we're all facing challenges, but the challenges are different depending on the context. So that was very interesting. Before I take questions from the audience, I wanna ask a few questions on some of the things we didn't mention in today's session. I mean, to Deborah, since you've applied this on a national level, similar to what we did, from Portugal's perspective, what are some of the key takeaways on some of the early policy conversations that have emerged from your participation in Paris?
What I can say, I mean, we were very fortunate to host the event that launched the report with OECD in February. So it's been a few months now. And what we can see is that from disseminating the results to specific groups, and I'm thinking, for example, about the Portuguese Association for Integrated Care, is that this particular study is helping to take stock of the momentum around care coordination, because it's something that has been highlighted and raised by multiple stakeholders, and it is constantly in the public policy debate. But having these clear, very clear data and being able to compare with other countries brings that to life. And the same applies to the digital health space. So as I said, we know that we are known for being good in this area, but of course there's always room for improvement. And when it comes to literacy, I think both the digital literacy and the health literacy more general are becoming more and more relevant in the public policy space as well. So probably I would highlight those two.
Thank you. That's really informative. And Michael, a question to you from your perspective. How are countries, from what you're seeing, how are they using Paris data to influence national healthcare policies?
Yes, thank you very much, Sarah. Well, that's a big question. So, first of all, it's good to note that, of course, policymakers are our main audience. However, we have been creating this, as you know, together with important stakeholder groups, and we see that helps also leveraging the impact. For example, we have been building a network of patient organizations that have been involved in every step that we took, because we thought it would make sense if you do something about patients to ask their opinions. And now they feel part of it, and it helps them in their advocacy as well. And they are also influencing policy. What we hear back is one thing that I think many policymakers maybe already knew, that healthcare systems today are often not necessarily designed around the needs of patients. Right? It's often the patient that have to adapt and navigate their way to a system rather than the system adapt to the patient. And that's something, a common problem that we know. And what we're doing here is trying to make that more concrete and more tangible. So what are the things that you can work on? And an important part of this, and that was broadly, like mainly a black box until Paris was here, is the specific problems of people with multiple chronic conditions. Because a lot of our health systems, but even our studies that we are doing, are often disease by disease. So we have something for the diabetes patient, we have something for cancer patients, but in reality, we see that 80% of our people in our sample have a chronic condition, and that more than half of them have multiple chronic conditions. So this is something that I think is a major issue, I think, to further research on.
No, that's really interesting, and I think we have a similar question from the audience. I think that's directed to me, but how to transform the data from Saudi Arabia to strategies and plans. So we're doing the same as well, just to pitch in what we're doing in Saudi Arabia. We're bringing the specific data to policymakers of relevance. So we're speaking to mental health experts, we're speaking to digital health experts, we're speaking to care coordinations to really show them the data. And tell them this is working really well, but this isn't and needs your attention. We're also trying to incorporate prompts as much as possible within national discussions, and just bringing the attention to patient's voice, patient literacy, patient-centered care, and value-based care. We're also digging deeper into some of the kind of specific findings for Saudi Arabia, and we're trying to make some conclusions. So you mentioned, Michael, about our results on higher performing mental health and lower performing well-being. I think it's part of our culture, and it's up to us to dig deeper into what attributes contribute to this higher performance or lower performance. I mean, yeah, so we're trying to do that. We're collaborating with researchers, we're collaborating with policymakers on how to do so. I just wanted to pose one more question to Deborah, since you're a communications expert. I mean, you have been one of the most active countries in communicating Paris. You hosted the launch of the flagship report, and you've been really active in this field. What strategies have you found most effective in engaging the public and policymakers with patient-reported data?
Thanks for the question. Within my last slide, you could see a QR code that is specifically a mailing list for Paris within DGS. And we can see that in the various activities we have either hosted or participated in, there is a growing interest both from patients, patient associations, and healthcare providers, and also those working in academia and in healthcare management. There is a growing interest in diving into some of these indicators and discussing them in more detail. So to answer your question, I would say that it's useful to be, or impactful to be, both reactive and proactive. We're, for example, currently organizing a policy dialogue in a couple of months to try and dive into the more in-depth analysis of the Portuguese data. So we would have fresh news, let's say, to discuss with some of these stakeholders before the national report is ready. And then, as I was saying earlier, engaging with stakeholders that focus on specific areas of this work. And integrated care, care coordination are so such hot topics that it's important to make room for these specific discussions. And if I may just, you touched on your culture, and this reminded me that in one of the discussions we had with stakeholders, and I think this was a comment coming from academia, we in Portugal have a culture of not always appreciating what goes well. And so we could also keep that in mind as we analyze this data, because maybe some of the negative findings could come from that cultural bias, so to say. Of course, there is always room for improvement, but it's something to keep in mind when we think about patient-reported outcomes and experiences. And this has led to a wider discussion about what our culture is and why we are like this. But I thought it was interesting to share, because it also shapes the way we communicate the findings, and we make room for those wider discussions.
Of course, that's really interesting. And I mean, you have your own cultural adaptations, and we do have our different cultural adaptations. So it's important to highlight those. I know we're at time, so I want to thank our speakers for participating, and I'll hand over to you, Khalid, to close the session.
Yeah, thank you. Thank you, Sarah. Thank you, Deborah and Michael. And thank you all for the active engagements through the thoughtful questions today. So our discussions highlighted how Saudi Arabia healthcare system performance compared to the OECD countries, and also the performance also from Portugal, and how things compare with each others, and also which also identified some of the key strengths and also the areas for improvement also for the healthcare systems. We've also learned about the some of the best practices internationally from different countries, along with some of the policy recommendations. So as we conclude the session, I encourage you to share your reflections in the survey that will be distributed after the session. And I would like to remind you that we do have actually an extra special session on May 14th as a continuation of this series, which we will be spotlight the Saudi Council for Health Insurance, CHI, PROMS feasibility study. The webinar will provide a behind-the-scenes look on how data infrastructure and provider readiness were assessed and what these findings mean for the broader measurement ecosystem in Saudi Arabia. It will also highlight a real-world provider experience and look ahead in the next phase of PROMS integration post-Paris. So please stay engaged with us and follow us on LinkedIn for the announcement very soon. Inshallah, for May 14th. On behalf of the Center for Value and Health, I extend my sincere thanks to our guests, Dr. Sarah Neef, Dr. Michael Vanderberg, and also Deborah Miranda, and to all of you for your participations. We look forward to continuing this vital conversation and building on it in the near future. So thank you once again, and see you next time, inshallah, in the Do Health Systems Deliver series. Thank you, everyone, for joining, and thank you for coming with us.
Thank you.
Thank you. Thanks very much.
Thank you.